tips for you all. Go in early and give yourself time to settle in and learn your flow. Starting off, you're not going to know how much time and effort you're going to need to pre-chart or pre-round on patients, so I would just go in 30 minutes to an hour early. When you're copying forward, please revise and update your assessment and plan for the day. It's nice to be able to read through a succinct progress note. An intern had asked me what she can do to be more efficient throughout the day, and I had noticed that she was updating her progress note every other hour. Once you close your progress note for the day, let it be. So after rounds, once you make your updates, close your note. If something happens in the afternoon, it's okay to just write yourself a little note or put it in the sticky to make sure you tell night team if it's something that's pertinent for them to know. But you can go ahead and update that the next morning. When it comes to other tips, dot phrases are going to be your best friend, so start creating them as an intern. If there's someone that has dot phrases that you like, ask them if you can copy them. Another tip that I think will serve you well is asking for feedback frequently. I love to ask for feedback. Even if I felt that I was doing good, I have a growth mindset and I want to be the best I can be. So if someone notices something or has constructive criticism or feedback that they can give me, I'm willing to accept it. If you're feeling really tired, try to go to bed early, and this is easier said than done, but avoid doom scrolling on social media. If you are going to be successful in residency, you definitely need your sleep. And then this is also easier said than done, but call out. It's okay to call out. My next tip is pre-rounds. Review vitals, overnight events, and then nursing notes. And when it comes to labs, sometimes the labs are not going to be in by the time rounds start or even when you're pre-rounding, so that's okay. But go and see your patients. Try to see all your patients because that's the only way you're truly going to have an assessment for the day and be able to create a plan for rounds. And then I like to prep my notes. I would go in and do all these things I told you, review vitals, overnight events notes. Then I would go see the patient. And if the nursing was around, I'd ask them for updates. And then after I saw my patients, I would go and prep my note. And we usually saw 16 per team, but 8 per resident. Rounds, as I said my assessment and plan. If the attending disagreed or agreed, I can make my updates and changes. And then voila, I'm done by noon or 1, and then I was able to help with admissions in the afternoon. Make sure you get lunch and then keep a bottle of water on you. I almost passed out third year when I was a senior. I think it was the 4th day. As a senior, you work 7 days straight. 13-hour shifts. And I think I wasn't eating breakfast as I should have. And on the 4th day, y'all, the room started swaying and rocking. The patient started swaying. And I felt myself leaning over. And my attending caught me. And the intern brought a rolly chair. And they wheeled me back to the workroom. Talk about embarrassing. But I keep a bottle of water on you. And next, I want to tell you guys about the resources I liked. I loved AAFP articles. If you have a question, just type in the topic, like for example, hyperthyroidism, AAFP, and you'll get a beautiful article with updated guidelines and treatment plans. And then you can use up to date. And they have a bookmark section. I loved the bookmark. For example, I got quite a few patients with poison ivy. The bookmark was helpful because, you know, sometimes you'll need to use oral steroids. I was always able to just quickly look at my bookmark and be like, oh, it's here. Okay, I need to make sure I add that for treatment. And then Stat Pearls, Healthy Children. Other helpful resources would be the American College of Obstetrics and Gynecology, American Academy of Pediatrics, and then Advanced Life Support Obstetrics, which is also a course which, as a family medicine resident, you should take that as an intern. So make sure you save that course manual because they have really great information. Some additional resources that I really liked were ICU Advantage for the MICU rotation. You're going to be dealing with vents, drips, and very ill patients. So it's really nice to just have a resource, and I would review this before you start the rotation. So then when there's certain medical lingo or jargon that you're hearing in the ICU that you're unfamiliar with, you'll be familiar because you watch these videos. Curbsiders podcast. Some of my co-residents really loved this. I listened to a few on my way to clinic because I chose the federally qualified health center. So I was driving 50 minutes to clinic and 50 minutes back home. So I would either call family and friends or listen to podcasts or music and jam out. App Go could be helpful quickly to review prior to starting your OB rotation as an intern, because I know 4th year you probably haven't really done much of obstetrics, so it would be helpful to just quickly review that. And then if you have an OB textbook that you like, you can use it during your rotation. For perineal lac repairs, Trix perineal lac repair video. For biostats on step 3, I put med immersion here, but I realized I think med immersion was one out of the many videos. So type in biostats step 3 and there should be a playlist on YouTube, and that playlist has some really great videos, and the med immersion video is incorporated in that video. For boards, get step 3 out of the way. I wish we could do it during 4th year of med school, honestly, so then in residency you don't have to worry about it. I ended up taking it my 3rd year of residency in the fall because our program recommends that you don't do it intern year, since we're basically doing every rotation. And they recommend 2nd year, but 2nd year I just felt like I didn't find a good time to take it. So I took it, I think October of 3rd year, but I would say it was stressful because with your residency schedule and studying, it can be a little difficult. I am the type of person that realized I do have test anxiety, so I need to do practice questions and a certain number of practice tests just so I can feel confident during the test, because the knowledge is there. It's all about test taking strategies as well. Get that out of the way. For board studying, family medicine board specifically, I would recommend using the AAFP app. They have 1,360 practice questions and up to 300 quiz questions. And then I redid my ITEs per advice from attending. So you can download your test on theabfm.org and then redo your ITEs. And ITEs are your in-training exams, which you do during residency each year to see your progress and just make sure that you're keeping up with things. Life and medicine.